Good morning, myself Dr. Nida Ahmedi, and I'll be speaking on the topic Surge in Current MYOPIC Incidence, a Post-Pandemic Boom. There is no financial interest. Simple or developmental myopia usually occurs between 5 to 10 years of age, and its development is driven by both genetic and environmental factors. The adoption of digital smart devices constitute a new form of near work, wherein children spend prolonged, uninterrupted period of time with closer viewing distance than the conventional books. During COVID-19 lockdown, the usage of digital smart devices has tremendously increased. Currently, the global prevalence of myopia is approximately 2 million, and it is predicted to increase to about 5 million by 2050. That is giving rise to myopic epidemic. Likewise, the prevalence has also increased in our country, as is stated by Amar Pujari et al. In his latest study. Therefore, it is important to identify the modifiable risk factors to decline the rising global burden of myopia and its complication. Thus, we aim to study the effect of digital screen time on incidence of myopia. It was a prospective observational study of 1 year duration conducted between November 2020 to November 2021. All the children between the age group of 12 to 20 years with increased screen time over last 6 to 8 months were included, and children with refractive error, amblyopia, strabismus, retinal and congenital disorders, etc. were excluded. A total of 154 children were taken up after satisfying the inclusion and exclusion criteria. Written informed consent was taken, and average daily time spent using different devices was quantified by self-reported estimates. A comprehensive ophthalmic examination, including uncorrected visual acuity, cycloplegic refraction, slit lamp, and fundus examination was done, and patients were followed up for 1 year. Coming to the results, no significant difference was found in age and sex distribution among the study population. The most common type of devices used were of handle types because they were more convenient, portable, handy, have application for everything, and using them for games and social media was relatively easy. Out of 154 total, 36 were newly diagnosed as myopes over 1 year of study, and incidence came out to be about 23.37%. These incident myopes were divided into 3 groups based upon their screen time, and it was seen that majority had a screen time of more than 4 hours. Also, the mean spherical equivalent was calculated, and it was seen that children with more screen time had more spherical equivalent correction, both showing a positive correlation with R value of 0.58. So, as found in the study, the incidence was 23.37%, which shows tremendous increase as compared to last few years. Secondly, it was noticed that most common type of devices used were of handheld types, which according to Bauge et al. May be a risk factor for myopia progression. Third, majority of them had a significant screen time of more than 4 hours, which according to Mary et al. Is an independent significant factor associated with visual impairment. And fourth, there was a positive correlation between the duration of exposure and the amount of spherical equivalent correction. Thus, incidence of myopia depends upon the number of hours spent on digital screen per day, the total duration of exposure, and the type of devices being used. So with this, I would like to conclude that during COVID pandemic, the research work has mainly focused upon the epidemiology of COVID, but the impact on myopia has largely been unnoticed. And although schools have reopened, but the growing dependence on these digital devices may persist even after the pandemic, which should not be overlooked. Our study has identified digital screen time as a modifiable risk factor, reduction of which can prevent the anticipated myopic epidemic. Thus, regular screening must be done for early detection and to prevent progression. The recommended screen time is 2 hours per day, but if it cannot be followed, then at least some preventive measures should be taken, like use of laptops over handheld devices, following 20-20-20 rule, which states that after 20 minutes of near activity, look at 20 feet distance for 20 seconds, and encouraging outdoor time of 2 hours per day. And lastly, and the most important, is to create public awareness regarding the effect of indoor near activity and reduce outdoor time on incidence and progression of myopia. Thank you. Ma'am, we haven't seen that. We have actually evaluated the mapping. Actually, we included all those which were without any refractive correction, and we followed them over 1 year. So, yeah, without any refractive correction, and we followed. No, ma'am, no control group. Yeah, it was an observational study. Yes, ma'am.